I think it's very hard to reduce carbon kind of footprint within a hospital, I think.
Everyone makes one small change, then overall it might make a difference. Well, I chose Hull because it's one of the most socially deprived areas in the country, and I wanted to be able to make a difference to these communities in whatever small way that I could. And then obviously the Humber Generalist School was everything, encompasses all of that. All of the modules spoke to me on a personal level.
What other issues of climate change?
We had a really interesting talk from a doctor who was speaking about greener practice. So what we decided to do was to look at inhaler use. A large proportion of people in this country still use metered dose inhalers, which use a propellant that is quite bad for the environment. I decided to liaise with one of the pharmacists and the respiratory specialist nurse as well, to try and figure out if there'd be any barriers to swapping patients onto the more environmentally friendly inhaler. It's a relatively simple thing to do. I feel that my project has made quite a significant impact. It's still something that's ongoing and we need to continue this going forward. There are still many patients that are on the inhalers that are still bad for the environment. So it's not just a one-time thing, this is something we have to think about daily. I think patients overall feel happy about making a positive difference to the environment, as long as they do realise that their health is at the centre of every decision that we make.
I work in a health centre called the Jean Bishop Integrated Care Centre, and it's situated on quite a large plot of land. I was sitting in the module on environmental sustainability, thought could we kind of transform some of that into a garden.
Sustainability and everything
There's
else.
so many benefits to getting outside, and from a mental health point of view, there's a lot of physical and mental health benefits to sitting, standing, walking and enjoying some garden space. And since then it's kind of evolved a little bit more into being more of a therapy garden, so actually trying to think about ways in which we can engage the patients that come into the integrated care centre to actually be like an integral part of the planting of the garden and also the maintenance of it. All goes to plan, the impact will be huge. So I would not have thought of the idea for the therapy garden without the generalist school. I would really recommend this way of working to multidisciplinary people. I think we all bring something different to the table, therefore we can all take something different back to our teams. It's been brilliant.